Good day everyone and welcome back to my YouTube channel. In today's video, we'll be discussing painful sex, which is also known as dyspareunia. Before that, if you are new to my channel, I'm Mesoma Nabrini and I discuss everything health. To my returning subscribers and viewers, this is me saying thank you for sticking around. Please don't forget to click the subscribe button and notification bell if you've not done that already. So let's go back to the topic of the day. What is painful sex? This is a persistent or recurrent pain experienced during and or after sex. Okay, these pains can be experienced by both genders. So what are the types of this pain? I'll be dividing them based on the location and timing. I'll explain what I meant. You have the superficial pain, which is felt during penetration. Okay, you have the complete pain. This is felt at all time. You have the primary pain. You have the deep or collision pain. This happens when there is complete penetration, and you usually feel this pain at the lower abdomen. You have the secondary pain. In this secondary pain, there is usually no pain during sexual intercourse, but you experience the pain after the sexual activity. And the last but not the least is the situational pain. These pains comes and goes, so it's not really frequent. Okay, so what are the causes of this pain? I'll be dividing them into psychological causes and the physical causes for both the male and the female. Okay, so let's start with the psychological causes because they're a little bit less. We have depression, we have anxiety, we have low self-esteem, then we have what we call post-stress traumatic syndrome. For instance, for someone who has been sexually abused, like rape, they tend to experience pain during sexual activities, regardless whether it's a lady or a guy. Okay, then the next one now for ladies under the physical causes is dried vagina. If your vagina is dry, you experience pain due to the friction there. This can as well be as a result of less stimulation and lubricants not being used, or your body not producing enough secretions during that period due to less arousal. Then we have what is called vaginal atrophy. This is the thinning of the vaginal lining. This can be as a result of hormonal changes, either premenopausal or menopause stage. We have the vagismus. What is vagismus? This is an involuntary contraction of the muscles around the vagina, leading to pain during sexual intercourse. We have problem with the ovaries, uterus, fallopian tube. For instance, if you have fibroid or cervical cancer or ovarian cyst, you tend to experience pain during sexual activity, and the type of pain you experience is the deep penetration pain because it's felt usually at the lower abdomen and not at the entrance. Presence of PID, that's pelvic inflammatory disease. These are diseases or infections that affect the female reproductive organs. So starting from the cervix, ovaries, uterus, fallopian tubes. Okay, this leads to pain during sexual intercourse. Have ectopic pregnancy. This is when the pregnancy grows outside the uterus in places such as the fallopian tube. You tend to feel pain. In presence of endometriosis. What is endometriosis? This is when the lining of the uterus goes out of the uterus to line somewhere else, like the back of the uterus, the fallopian tubes, the ovaries, etc. Then having sex too soon after childbirth or any surgery leads to pain as well. You're expected to let the surgery heal properly. The next is vaginal infection or STIs. They make you feel pain. You also have injury to the vulva or the vagina. I've made a video on the female reproductive system, so if these names I'm calling is confusing, I will drop the link to the description box for you to go revisit the videos to know actually what these organs look like. For the men, what makes you feel pain during sexual intercourse? They include damage to the foreskin. These damages can be due to presence of infection or just tear. Okay, then you have STIs as well. They can make you feel pain during sexual activities. The next one is penile deformities. Example is in presence of perineal disease, where your penis is curved as a result of one injury or the other. Last but not the least is what we call priapism. So in this priapism, what actually happens is, you know, when you have erection, your blood pulls towards that area. So in this case, it is trapped and not being able to drain. So this causes pain at that time, and this should prompt immediate action. If not, it can lead to permanent erectile dysfunction. Okay, so let's go over to the treatment. So this treatment is individual. You need to see a doctor who will run some examinations for you. For instance, carry out a physical examination, carry out ultrasound, especially transvaginal ultrasound, which will guide them, or which will give them a better view of your female reproductive organs to see if there's fibroids or endometriosis, or if there's change in the cervical lining. And also carry out what is called laparoscopy if the above listed examinations were not conclusive. For the ladies, pap smear or pap test can be done. This is to help dictate abnormal changes or presence of abnormal cell in the cervical area. So if your cause is as a result of vaginal dryness due to low stimulation or no lubricant, you can make use of water-based lubricants, or you can advise your partner or talk to your partner to at least carry out foreplay before penetration. So we've come to the end of today's video. Please don't forget to click the subscribe button if you've not done that already, and turn on the notification bell to get notified on when next I post a new video. Thank you. Bye.